Hereditary angioedema is a rare disease that causes swelling in various parts of the body, but it can often be mistaken for an allergy and go undiagnosed for years.
My name's Rachel. I've had hereditary angioedema for most of my life. My parents first started noticing I had symptoms around about the age of 18 months, 2 years old, when my mum said that people were stopping her in the street saying, "Your daughter's been sick in a pushchair."
Hereditary angioedema is a rare but potentially life-threatening inherited condition. The disease causes unexpected swelling in various parts of the body: the hands, feet, face, and particularly dangerous, the airway, which can lead to death by asphyxiation. HAE affects around 1,300 people in the UK. Rachel is one of them.
I think HAE is so rare that nobody knew about it. None of my doctors had ever heard about it. The GPs had no idea, no experience of HAE. So I guess for the 13 years that I was undiagnosed, I was sick quite often. I was probably having 1 or 2 attacks a fortnight, which meant I missed school. I felt a little bit socially excluded from my school friends, and I missed parties.
One of the most difficult things about HAE is that it's so unpredictable and can vary dramatically depending on the severity of the disease. HAE UK is a patient support and advocacy charity. Over the 10 years since its foundation, it's worked to improve HAE diagnosis and treatment. It's also an autonomous member of the overarching non-profit network HAE International. HAE UK provides one-to-one support for patients like Rachel and their families, creating an essential community for people who often feel very isolated. HAE UK also collaborates with a medical advisory panel and supplies local and national educational patient days, literature, meetings, events, and a 24/7 helpline.
There are some patients who have 1 attack a month. There are some patients who have 1 attack a year. There are some patients who have no attacks. But that isn't to say that they might not suddenly have a severe attack. And that's why it's so important that everyone has a diagnosis.
But the problem is, because it is so rare, affecting just 1 in 50,000 people, HAE patients frequently spend a long time before they are correctly diagnosed.
A lot of people within the healthcare community confuse it with an allergy, and that's still a common misconception of the condition. And as a result, patients get misdiagnosed, still on average for much too long for my liking, and as a consequence of that, they sometimes end up receiving the wrong treatment.
Takeda Pharmaceutical Company Limited is committed to supporting the HAE community and raising awareness through collaboration with patient organisations such as HAE UK.
It's really important that we get the education out there, we get the disease awareness out there with the various healthcare professionals.
Nowadays, everybody tends to be much more web aware. And so we were involved in a project with Takeda on their No HAE website. It's full of content that is raising awareness about HAE that can be used by medical professionals and also for patients. It's a very valuable resource for patients.
Patients like Rachel, who thanks to raised awareness, better diagnosis and modern medicines, are able to live with HAE and lead normal lives.
I think my hopes for the future for people with HAE is for everybody, no matter where they are in the world, to be able to lead a normal life, and for everybody to be able to connect and to feel normal and not to feel different because they've got HAE. HAE shouldn't be a barrier to stop people from doing what they want to.